First tests and scans. Your midwife will offer you checks when you tell us you are pregnant. These are for the health and safety of you and your baby. They include blood tests and scans. Checks happen at different times during your pregnancy. Your midwife will tell you when these will happen. You might have the same test more than once. This is to check everything is okay with you and your baby. You can say yes or no to having a blood test or scan. Blood tests and vaccinations. Tests carried out by your GP practice or midwife are free. Blood tests will check for sickle cell disease and thalassemia, blood type, rhesus status, and infections. Sickle cell disease is when it is hard for the blood to move around your body. Blood might get stuck, which can be dangerous for you and your baby. You will need extra checks if you have sickle cell disease. Rhesus status checks to see if you have a protein in your blood. If you are rhesus negative, you will need other checks to keep your baby safe. Infections include hepatitis B, syphilis, and HIV. If you have an infection, your care team will offer you treatment. You can ask questions about your treatment choices. Vaccinations help keep you and your baby safe. Your care team will check which vaccinations you have had. They will ask if you want to have vaccinations to protect you and your baby. Scans. There are different reasons why you might have a scan. An early pregnancy scan checks the size of your baby, the heartbeat, where your baby is, how many babies you are having, and if your baby is growing well. A nuchal translucency scan looks at the space at the back of your baby's neck. This checks for Down syndrome, Edwards syndrome, and Patau syndrome. Your midwife will tell you if there is anything you need to do before these checks. You can ask your midwife questions. All checks are carried out by trained professionals. They can support you to understand the results and what happens next. You have a right to make decisions about your care. Sometimes you might need extra help during your pregnancy. Talk to your care team if there is anything you are worried about. This will help you plan to keep you and your baby healthy. Go to the tommies.org website to see when to call the midwife. You can find the link to this website in the description box under this video. You may need to call your midwife during your pregnancy. You can do this using one of the phone numbers on screen. You can find these numbers in the description box under this video. Ask your midwife if you are not sure which hospital they work at. Click here to watch the next video about how to get help. Thank you for watching.